I had been limping for about 3 years. I didn't think it could be that bad, but I thought I should have it checked. And so went to my primary, and he sent me for an x-ray, and then got back with me and said, you need to do some physical therapy, which I did, and that kind of made it feel better when I was doing the actual physical therapy. And then he said, I want you to follow up with Dr. Longenecker. So I went, and it was completely unprepared for him looking at that x-ray and telling me just how bad my hip was. It was osteoarthritis, and it had just really gotten into that joint, and he just couldn't even believe that I was walking on it and putting weight on it. He said he felt like that it would collapse at any time. He said, you need a total hip replacement. This was on that Tuesday, June 19th, that we went. And one thing that struck me about him, he told me the truth. He told me what I needed completely, but I've never had a doctor hop up. I was sitting up on the exam table, and he hopped up beside me and sat there and talked to me as if I were the only patient that he had, and just was extremely comforting and explaining, what this was gonna be like. And then the next Tuesday, went back in, and I said, tell me again, convince me that this needs to be done so that I can understand it. And he did. He took another x-ray just to see where it was. He said it's very much necessary that we do this. And so I said, okay, well, let's do this as soon as possible. And he said, how about tomorrow? He said, I have a cancellation. So we did the surgery on Wednesday, June 27th. And he mentioned that he could do an anterior approach. What that is he comes in from the front so that you're not having to cut those nerves and muscles in the back. So those things are just pushed aside so that the healing is much faster, and the scar is generally a little bit shorter than it might have been. So I appreciate that so much, because I know that my healing has been so much faster. And I know when I went to the joint, they call it the joint camp, down the hall and in the orthopedic floor, when I went down there and saw all the other patients with the other approach, I mean, I was sitting up past 90 degrees, even with my knees raised up. I was able to get up and down so much easier with little pain, and there were several things that I was able to do that I could see that they were not able to do. A lot more soreness and stiffness that I have not had to deal with. So I appreciate so much that he was trained in that, and that he offered that option to me. Almost 2 weeks past surgery, I quit using the walker, and then the cane, it's kind of optional. I've been walking around without it for several days now. And so I'm just going to keep walking and working the hip, and that's my therapy pretty much. I love to ride bikes, and so looking forward to getting back. My husband and I like to do that. And then just getting down on the floor and playing with grandbabies and being able to get up without pain. Really looking forward to that. I've learned a valuable lesson. Go to the doctor and go quickly, and don't put it off. So I'm telling people that, and it's amazing what they can do, and how well they can do it, and how quickly you can get well, especially with this new approach. And I'm hoping that there would be some people that I would run into that would be candidates for that, and that I could encourage them to go to the doctor, and especially Dr. Longenecker, and see if maybe that approach could be done for them.